Hello, everyone. I'm Richard Conway, reporting for Room Now from ACR 2023. I'm reporting virtually from Dublin, Ireland. I'm going to talk to you today about abstract 1629. This was presented at Monday's rheumatoid arthritis oral abstract session. This was by Caleb Michaud and colleagues. This was titled Persons with Rheumatoid Arthritis and Long COVID. And then there's some other stuff which I'm going to skip for now in the title because it really gets at the study outcomes. So long COVID, we know all about this. It's very much entered the mainstream knowledge and it is not just confined to health professional discussions. It's common, seen about 30% of COVID cases, and in about 10% of those, it seems to be more persistent, so it doesn't resolve soon after COVID. Those of us who've worked in this area for some time have noticed a lot of similarities between long COVID and other conditions that we've seen. So fibromyalgia being one that we see in rheumatology, and also previous post-viral type syndromes such as chronic fatigue syndrome and ME. So the authors here looked at 667 patients who had rheumatoid arthritis and COVID. Of those, 15% were diagnosed with long COVID. And what the authors here were looking at was the characteristics of the patients before they got COVID and what happened during COVID. So before COVID, they found that patients who subsequently went on to develop long COVID had a much higher rate of fibromyalgia as a pre-existing diagnosis, threefold increased risk, seen at 41% compared to 13%. Those who got long COVID tended to be older. They were less likely to be white. They had lower socioeconomic status. They had more depression, more comorbidities, and had worse rheumatoid arthritis-related patient-reported outcomes, all before COVID happened. Their long COVID itself tended to be more severe. They needed more intravenous antibiotics and had more hospitalizations for COVID. But both of those things did not happen to the majority of patients who developed long COVID. So the IV antibiotics was 23% versus 9%, and the hospitalizations was 18% versus 5%. So the authors came out with a real hot take on their discussion of what these results meant. And they suggested that long COVID symptoms may reflect pre-existing illness that was there before COVID. That is probably going a bit too far for me. I don't think the data definitively lets us say that. I think it's probably not true either. I think what we can say was the author's other conclusion that those with long COVID did have many symptoms that would be consistent with long COVID before they ever got COVID. So naturally then, when COVID developed, those symptoms could be attributed to long COVID as opposed to fibromyalgia or something else, which would have been attributed to before COVID. I think really what we are seeing with long COVID, or at least my conceptualization of it, is that lots of things play into this. Some of those are the things that happen during the COVID itself. Some of them may reflect pre-existing characteristics of the patients or of their diseases. I think another way of looking at this is if you have fibromyalgia to start off with and everything that comes with that, the symptoms, the impact of that on your life, and then you get COVID on top of it, I think it's natural to expect that you probably are more likely to develop symptoms of long COVID. So remember to check out Room Now for all the updates from ACR 2023 and follow me on Twitter at Richard P.A. Conway.